Hello, everyone. Welcome to MedicAlert's live healthy hour. We're really glad that you joined us today. We're super excited to offer another live healthy hour for you. This time we are focusing on women's health during COVID-19. Our healthy hours, as you know, were created with our members in mind, connecting as a community and providing additional resources during these trying times for us. My name is Melody Howard, and I will be your host today. I'm the Community Alliances Director at MedicAlert Foundation, and joining me as co-host today is Julie Hilton, our Vice President of Communications. Welcome, Julie. So today we will cover, and I'll share some information about MedicAlert. You'll meet our speaker, and then we'll spend the bulk of our time on Q&A with Dr. McGinty. And the subjects we'll cover today are questions related to women's health, breast cancer screening, and COVID-19. And as always, we'll share some valuable resources for you towards the end of our session today. So here is a little bit about MedicAlert. For those of you who have not joined us in the past and are not really familiar with the services that we provide, MedicAlert is the original medical ID created in 1956 by a local physician in Turlock, California. And he created the organization as a means of ensuring medical responders knew about his daughter's potentially fatal allergy in an emergency. Since that time, MedicAlert has become the nationally recognized symbol for medical emergencies. What's so unique about MedicAlert is that we go just beyond an ID. Our IDs are backed by our dedicated emergency response team 24/7. This team is always standing by to relay your critical medical information and to those treating you in your moments of need. We are the only nonprofit organization in the medical ID space. All of our revenues fund our emergency services and help provide IDs and memberships to people in financial need. Our mission, after 64 years, still remains unchanged, and that's to save and protect lives by sharing vital information in our members' moments of need. I'll share a little bit about how the service works. So your medical ID is engraved with your most vital medical information, and that first responders need to know right away. In an emergency, they contact our 24/7 emergency response team to get your full health record. Your health record includes additional health data and emergency contacts, which we relay to emergency personnel. We've been training first responders to look for your MedicAlert ID, empowering them with vital information. So important for first responders to know about any existing conditions or important information so that you get the best possible care. MedicAlert is your voice when you need us most. So today I'm very excited to introduce you to our speaker, Dr. Geraldine McGinty. And Dr. McGinty is a board certified radiologist specializing in women's imaging. She is assistant professor of radiology at Weill Cornell Medical College. She completed her medical training at the National University in Ireland, along with a residency at University of Pittsburgh and fellowship in women's imaging at Massachusetts General. She is an internationally recognized expert in imaging economics. In addition to her clinical practice, she serves as Chief Strategy Officer and Chief Contracting Officer for the Weill Cornell Physician Organization, more than 1,600 members. Dr. McGinty is also president of the American College of Radiology. Welcome, Dr. McGinty.
Thank you so much for having me today.
Well, I know that we have a hard stop today at a certain time, so I want to make sure that we get into as many questions as we can in for Dr. McGinty. So our first set of questions is in the category of women's health, and this question specifically was submitted by Allison. During the COVID-19 pandemic, what, in your opinion, has been the biggest impact to women's health?
Well, this is a very broad question, and it's tough to generalize. I mean, clearly, we've seen women who've obviously suffered through having COVID themselves, and we've seen many more lives lost than we would ever have hoped. And there are clearly parts of the world where access to sexual and reproductive services is challenging at best. So this pandemic has made that worse. And Likewise, we're seeing significant concerns around gender-based violence that's increased during this time. But probably what I'd like to focus on is our wellness and our mental health, because what we're seeing, and this is some data from the Kaiser Family Foundation, is that women are really reporting more negative feelings about their mental health, worrying about coronavirus. And I think we'll talk more about what we need to do to take care of ourselves. But I think as we look at the combination of responsibilities that many women have, adding COVID-19 onto that was just the last thing we all needed.
Thank you. So our next question, submitted by Faith, how important is it for women to maintain their regular appointments with their OBGYN or PCP?
Well, thanks for this great question, Faith. And obviously, in the early days of the pandemic, I practice in New York. We really had to shut down a lot of elective care as we all focused on both safety and also the rising number of cases of COVID that we had. But as we've come out of that, and certainly as we're managing managing those cases differently, it's really important to maintain our appointments with our preventive care and the physicians who take care of us on an ongoing basis, especially if you're suffering from a chronic condition. So I would say it's extremely important. And what's been, I think, a positive during this pandemic is that we've seen the expansion of telehealth, the ability to see your doctor for almost all of what you need to do using video or even telephone from the comfort and safety of your home. So most doctors have adapted very nicely and very quickly to that. So all the more reason to keep up with your regular appointments.
And I think it goes to, it makes me think about when you board an airplane and they always tell you, if the oxygen mask drops, you put it on yourself first before you can help someone else. And with women, women are caregivers, right? Often for children, for older people. And if they're not taking care of themselves, they won't be in a position to help take care of others when needed. So
such a great point, Julie. Yes. And I know you've had a lot of challenges. We've all dealt with a number of things that we've had to be responsible for. Putting our own health last is something that we women often do. And I would urge us to, thank you, Faith, for this great question. It's a great reminder. We shouldn't do that.
So our third question is in the category of breast cancer screening. Sally asks, should I still have my annual mammogram?
Thanks for this question, Sally. And the answer is absolutely yes. Again, now that we've gotten through the early days where we did have to shut down elective screening, it is so important not to miss a year. What I will say is that, with guidance from the American College of Radiology, we've helped facilities to really gear up to provide that care safely. Cleaning the rooms, appropriate social distancing, obviously screening you before you come in, but it is so important. The reason we choose an interval of every year is because we want to, in the event that you had a breast cancer, we want to be picking that up as early as possible so that it is treatable and often curable. So we don't want you to miss a year. I definitely understand that there's some concern about coming on site, but as I say, you'll find if you check in with your local facility, and every facility that provides mammography services in the US is accredited by the American College of Radiology or one of the other accrediting agencies. So you will find that they have put in place procedures for your protection. So the answer is absolutely, get that mammogram.
So our next question, submitted by Ginger, I don't think I have a high risk for breast cancer. Do I still need an annual mammogram, especially during a pandemic?
And this is a question we're often asked even outside of the pandemic. Nobody in my family has breast cancer. Do I really need to get a mammogram? And even though if you do have a significant family history that can increase your risk of breast cancer, most women who get breast cancer don't have a significant family history. So, even though you might not think you're high risk, we know that 1 in 8 women will develop breast cancer over their lifetime. So yes, absolutely. We want you to come and get a mammogram. We recommend it for all women over 40. Now, if you are at higher risk, whether it's a family history, whether it's, if you know that you have a genetic mutation, or perhaps you've got other high risk, maybe you had, radiation for another condition earlier in life. That's often a conversation that you want to be having with your doctor about whether you actually need additional screening and on top of your mammogram with ultrasound or MRI. Those are more specialized guidelines, and definitely have that conversation. But, average risk means that you should be getting a mammogram every year over 40.
I think the really shocking fact as we were looking through this was that 75% of the people that are diagnosed don't have any identifiable risk factor.
It's a great point, Julie. Yes, and most people don't, and so that's why we screen everyone over a certain age.
Good.
Thank you. So our next question, submitted by Sandy and Bridget: what's the difference between screening and diagnostic mammograms? Is there a difference between film, digital, or 3D mammography?
Great, thanks Sandy and Bridget, lots to unpack here. So let's start with the difference between screening and diagnostic mammograms. So a screening mammogram is a mammogram that we do as purely a preventive service. Just it is where you're not coming in with any symptoms. We do this routinely every year. And a lot of facilities will do your screening mammogram, and in order to make the process as efficient as possible, they will not necessarily read it while you're there. The radiologist won't necessarily interpret it while you're there. What that means is there's probably about, on average, a 10% chance that you might get called back for some additional pictures. And you should never panic when you get that call, because that's expected. Sometimes tissues overlap. Sometimes we just need to see an area a little bit differently. And most of the time when you have to come back from a screening mammogram, it turns out to be nothing. But when you do come back for that mammogram, that's now called a diagnostic mammogram. So we do diagnostic mammograms if we've asked you to come back after a screening mammogram. We also do diagnostic mammograms if off the bat you have an issue. You're feeling a lump, you're noticing a discharge from your nipple, or you've had a recent surgery for breast cancer or something else that we're following closely. That's a different mammogram. And in that case, the radiologist will interpret it while you're in the office. When we do screening mammograms, there's a set number of pictures we do. When we do diagnostic mammograms, we do whatever pictures we need. We tailor the exam to what it is that you need that day. So sometimes that can take a little bit longer. So you will typically plan to be with us a little bit longer, but you will get your results before you leave that day. The radiologist will tell you, hopefully they'll tell you everything's fine. Sometimes they'll tell you you need a biopsy or you need to come back, say in 6 months, but you'll get that result that day. So screening is when you're just not having any symptoms. It's just your routine annual mammogram. And diagnostic is when we're really tailoring an exam to do what we need to do to solve a particular problem. So your next question was about the difference between film, digital, and 3D mammography. So let's start with film. And I'm sure there are still some facilities doing film. It's entirely fine to have a film screen mammogram, but the vast majority of film of mammograms now are done digitally. So instead of acquiring a film that you put up on a light box that might be sort of what you've seen radiologists do on television, we have a computer screen in front of us and we bring up the image of the mammogram digitally. And that was a huge advance for us because it meant that, we didn't have to worry about those old pictures getting lost if you moved or you changed facilities. And we also know that there were things we were able to see better because we were able to adjust the images electronically. 3D mammography was yet another enhancement. And what that does is instead of just taking sort of a flat picture of the breast, it's almost like almost like a CT scan, almost like a CAT scan of the breast, which allows us to sort of scroll through the breast and really, I would describe it as it means that we can move the tissue out of the way and see what's behind it. And what's great about 3D mammography is two things. One is it means that the number of times we have to call you back from screening is less, so that's all good. And then for women with dense breast tissue, and I'll talk a little bit about dense breast tissue, it means that our chances of finding a breast cancer are higher. We do a better job with 3D mammography. So I think that, if you are offered a 3D mammogram, there's definitely advantages to having that 3D mammography. Let me just talk, Julie and Melody, briefly about dense breast tissue, because I see actually somebody put it in the chat. Everybody's breasts are made up of a combination of fat and glandular tissue. And the glandular tissue is essentially the functioning breast tissue. It's what allows you to breastfeed. And that combination is different in every patient. If you have more of that glandular tissue, it's what looks white on the mammogram. That means you have dense breast tissue. So what does it mean to have dense breast tissue? Well, there are two things to know. The first is it does make your mammogram harder to read. The second thing is that it is associated with a slightly increased risk of breast cancer. So it's important that we decide, is your breast tissue dense? Because then we might make decisions about additional screening, perhaps with ultrasound, and we give you a sense of how much you can rely on the mammogram, knowing whether your tissue is dense or not. And most states now have a law that requires us as the radiologist to notify you as the patient about whether or not you have dense tissue.
And is that condition, the level of density, is it independent of any other factors like body type or race, ethnicity? I don't know if it's correlated with any of those.
Pretty much. It really is. And it's incredibly variable. So yes, pretty much.
So our next question submitted by Trisha. I've heard conflicting information for when women should start breast cancer screening and frequency of screening. What is your advice?
Well, thank you, Trisha, and I know it's good. Let's just say that all of the organizations who've put guidelines out there acknowledge that we save the most lives when we start at 40. The American College of Radiology, the Society of Breast Imaging, we are the radiologists, we are the physicians who interpret mammograms, say start at 40 every year, and as long as you're in good health, keep going. There are other organizations that say start a little bit later, don't screen as often. We would regard those guidelines as a missed opportunity for women's health. This is a relatively easy test. Yeah, it's a little uncomfortable, but it's the opportunity to detect breast cancer while it's tiny, while it's curable, is an opportunity that we wouldn't want to miss. And certainly, our belief is that we save the most lives starting at 40, and that's when you should start. I think actually one of these statistics it always shocks me every time I see it, which is 1 in 6 breast cancers occur in women under 50. So, and those are women obviously with, many years of productive life ahead of them, often with small children. Those are women whose lives we absolutely want to save, all lives, but why we would miss an opportunity to save those lives is beyond me.
It is frustrating because it seems like every couple of years something comes out that says, oh, do you really need to do it? Do you need to do it every year? So it's really helpful to have a very cut and dried recommendation on the best way to protect the most people.
And I think our next question, you've answered that already. So I'm going to move on to the next slide. I think that we do have some information about that, maybe to give some more information.
Absolutely, and certainly whichever facility you choose for your mammogram should be able to provide you with this type of information. But we'll also send this out. This is from the American College of Radiology, and I think one of the questions I sometimes get asked is, well, you're telling me that I have dense breasts, so the mammography is harder to read. Well, why am I bothering to get a mammogram at all then? Why don't I go straight to an ultrasound or an MRI? Well, it's important to know that mammography is the test where we have robust evidence that it really does make a difference in terms of saving lives from breast cancer. And also, there are some specific signs of breast cancer that we really only see on the mammogram. So we do still recommend that you have the mammogram.
When you talk about those signs, are you talking about things like calcifications?
Exactly. Exactly, Julie. Yes, calcium.
I feel like everybody's heard that term, but I don't know if everybody is clear on when you hear, oh, we're seeing some cell calcifications or microcalcification, hard word to say. What does that mean?
Sure. Calcium deposits, they show up as sort of little white spots or dots on the mammogram. And I will say that they're very common. Many women have them. In fact, most women have some calcium deposits, and the vast majority of them are nothing to worry about. There are certain types that can be a sign of breast cancer, and sometimes the earliest sign of breast cancer. So how do we know which are which? Well, we look at shape and size and distribution. Unfortunately, it's not always possible from the way they look to determine what they are. So sometimes we'll have to do a needle biopsy to determine what they are. But just because you've been told you have calcium deposits, that you shouldn't panic about that, but you want to know that your radiologist is looking carefully to determine whether these are calcium deposits that might need additional testing.
So our next question, submitted by Julie: when might I need additional breast screening, like an ultrasound or breast MRI?
Great question, Julie. So I already talked about the fact that sometimes for dense breasts, we'll add additional evaluation with ultrasound. There are certainly people whose family history of breast cancer risk is high enough that they will need additional screening with MRI. So that's something that you would talk about with your own doctor. Typically, and I'm generalizing here because it's worth sort of going through a detailed history, but typically if you have two first-degree relatives, and what I mean by first-degree relatives, mother or sister, if you have two first-degree relatives with premenopausal breast cancer, so breast cancer before menopause around 50, that means that you're in a high enough risk category that we should be doing an MRI on you every year in addition to your mammogram. There are some other conditions, people who've had Hodgkin's lymphoma, which sometimes requires treatment with radiation to the chest, that can increase your cancer risk. And there are some other genetic syndromes that would put you at risk. Now that's one category, that's screening. But know that we also use ultrasound and breast MRI as problem-solving tools, whether it's for something we've seen on the mammogram that we need additional detail about, or we will often use breast MRI in someone who's been newly diagnosed with breast cancer if we want to get a sense of exactly how extensive the disease is. So we use these tools in various situations. What we always try to do, though, is use them appropriately and not use them when we don't need them. MRI especially is exquisitely sensitive. It picks up, it is more sensitive than mammography and ultrasound in finding breast cancers. The problem is it's not always very specific. What do I mean by that? It picks up a lot of other things too, a lot of false positives. So we want to make sure that we are thoughtful about using it so that we're not subjecting people to additional biopsies or additional testing, chasing down these false positives. So this is something that when you need these extra tests, the radiologist who's interpreting your mammogram should be able to speak to you and talk you through this and answer your questions.
I know we talked earlier about the recommendations for everyone, right? Start at 40, mammogram every year. Are there different recommendations for people, and I'm sure there's many on this call, myself included, that have already had breast cancer? What is the type of follow-up protocol that you as a radiologist would recommend?
That's a great point. So we will typically work with you and typically your surgeon, who's usually the quarterback for your care in that regard. Mm-hmm. Oftentimes we will see you a little bit more often in the first few years after your initial diagnosis and treatment. We might do some extra views of the scar area just to keep an eye on that. But by and large, we should be able to get you back to routine screening within a few years. I will say in my own practice, we like to give people, even though people with breast cancer can go back to screening. And what's important about that is it means you don't have to pay a copay. Even if we get you back to screening, we typically like, if possible, to give you your results that day. We know that coming back for your mammogram after you've been through breast cancer treatment can be a pretty scary day. So we want to do everything we can to reduce that anxiety.
And would you recommend then the MRI for somebody that had had breast cancer before?
That is something that is I think some places are doing it. It's not universal, and not all insurance companies are covering it. That again should be an individual decision. And obviously, if between you and your physician and the radiologist, you feel like there's a compelling reason to add that to your screening, that may require a conversation with your insurance company in terms of whether they'll cover it or not.
Got it. Okay.
So I do want to add one little other point about people who might not fit into the normal screening methodology or guidelines. If you have a first degree relative, so again, mom or sister with premenopausal breast cancer, we usually like you to start screening 10 years before they were diagnosed. So if your mom was unlucky enough to be diagnosed with breast cancer at 40, we don't want you starting at 40, we want you starting at 30.
Good to know.
So our next category of questions deals with women's health. This question was submitted by Joyce. I'm due for a colonoscopy. Should I still get it done?
Absolutely. Absolutely. I mean, I think, again, most facilities are back up and running. We did want to highlight here the option of virtual colonoscopy, which is basically a CAT scan, where we sort of adapt the way we take the images and the interpretation to essentially replicate what we're able to see with what we call an optical or traditional colonoscopy. The results are we know that the efficacy of this in terms of seeing significant polyps is exactly where it needs to be. And it's covered by most insurances. Medicare doesn't cover it for screening, unfortunately, but certainly check with your insurance company, and it can definitely be a better tolerated alternative. But whichever way you do it, this is absolutely not something you want to miss. It's an important test. And specifically, I think we all, not women's health, but we saw also the tragedy of losing Chadwick Boseman this summer. We want to make sure that, especially in our communities of color, we're getting screened.
So our next question was submitted by Michelle. What are some other women's health concerns that should be addressed right away, even during the pandemic?
It's a great question. And I think, we often hear about the fact that women present with slightly different constellations of symptoms for things like heart disease and stroke. It'll be on the scope of my expertise to talk through a lot of that, but, really, I think paying attention to our health, and obviously any of those symptoms like chest pain or any kind of neurologic symptoms, loss of speech or loss of motion or power, and that's something you need to take care of right away. And I totally recognize that during this pandemic, there might be some trepidation about going to the emergency department, but again, we are set up to see you safely. Do not ignore these symptoms, and do not, put your own health last. So certainly anything that's a sort of a traditional emergency, stroke, heart disease, you absolutely need to be taking care of that. But I also think that, as we think about where we are, almost, it feels like about 100 years, but, coming to the end of this difficult year, really being alert to, where we're not sleeping, not eating, just finding it just difficult to get up in the morning, and feeling even more exhausted than we might expect, because, our mental health is something that, has been extremely challenged over this year. Even those of us, who are still employed, who've got robust family structures, are finding it tough. So for anyone who's got more than the usual challenges, those are things we shouldn't ignore.
I feel like I'm seeing more and more people that I feel like have done such a great job through, I mean, you're right, this longest year ever of, keeping it together, staying positive. And I just feel like I'm seeing more and more people kind of hit a wall lately of just fatigue with everything, with the constant anxiety, with the health concerns, with the lack of social interaction, with all these other things. And I don't think you can underestimate really what the long-term effects mental health wise are going to be for people.
Yeah, I think at the beginning of this, I know with my teams for my administrative work, we had group yoga, we had fitness challenges, we had bingo, and then, that sort of petered out. And, I think you're right. People are a little bit exhausted now. I will say, we had our first vaccines delivered yesterday, and I feel just such a sense of optimism and hope, knowing that we have light at the end of the tunnel. So I'm hoping that that's really going to having a sense that we're going to get beyond this is going to be helpful. Now, recognizing again that, some of the financial impact, and, again, keeping going with school and all those things. This is not over, and it remains a challenge. So, yeah.
I'll go back to one other thing just on this question specifically. We've done a number of these sessions over the year. We've talked to people that are experts in diabetes and Alzheimer's and heart disease. And one of the things that they've continued to stress to us is, if you have some sort of chronic condition, now is not the time to stop your regular doctor visits, any kind of maintenance that you do around those conditions, because many of those conditions are, if you are unlucky enough to catch COVID, that those conditions can be serious risk factors for more severe illness. So, just letting people know that, doctors are putting in place ways to keep people safe if they need to come in and see them, and not to just let go of that regular care.
Couldn't agree more. Absolutely. We definitely saw that people with pre-existing conditions and comorbidities were definitely more challenged by COVID. So absolutely.
I think I saw a figure in some of the information you shared. I'm not sure if it was American College of Radiology or the Society of Breast Imaging, that, because of delayed care, they estimated that potentially up to an additional 5,000 women could die this year from not having detected their cancer early enough. And that to me was just such a sobering fact.
Absolutely. I mean, just anecdotally, we know that in 3 months of this year, of this spring, compared to 3 months of last spring, we diagnosed 1/10 as many breast cancers. And we're obviously working incredibly hard to catch up and get people in and extend our hours. But, we know that there are people who just aren't going to make it to get to us this year for whatever reason. And, again, that's scary.
So our next question, submitted by Roxana. Women are often caregivers for either children or parents, and sometimes both. How do we take care of ourselves during this time when we're being stretched so thin?
Well, Roxana, I hesitate to put out advice there, because I don't know that I'm always as balanced. I'm not taking care of kids, and parents are all doing okay. But I think it goes back to all of the questions about, should I take care of my health? Should I not miss my appointments? It's really acknowledging that we do need to put ourselves, put our own health as a priority. And I think we've all shared tips and, over this time, whether it's whatever works for you. I mean, I certainly know that for myself, finding time to exercise, even if it's 10 minutes on the carpet in my bedroom, that's really positive. So I think that, finding whatever it takes to make some time for yourself. Some of the meditation apps have been very gracious and given out free access for healthcare workers, that kind of thing. We know that can really help. So, and I think, finding community, that's something that I think women are great at. So this is the fact that we're together today, I think, is really important.
Totally agree. So our next question, submitted by Ann Henry in Maryland. Any special advice for older women? What regular screenings are important for us?
Right, well, probably beyond the scope of today to go through them comprehensively, but certainly when it comes to mammography, we recommend that as long as you're in good health to keep coming every year. And then I think it's a question of working with your own physician, depending on whatever conditions you might have, whether it's for preventive care or whether it's for the various vaccinations. Certainly I think not necessarily a screening, but your flu vaccination is extremely important. And one thing that's been a positive from the pandemic is we've seen that the rates of immunization for the flu have gone up significantly. So.
One of the questions that we had that didn't make it into here was specifically around bone density screening.
Mm-hmm.
And if you have any information on the recommendations for that, I believe it generally starts at 65.
Right. I think we can share something that has the recommendations. And again, those recommendations have evolved over the years. So we definitely target them now towards older women. Unfortunately, there are some concerns about, having bone density measured and then finding yourself in a situation where your insurance premiums are higher, which I'm not an expert in that field, but that seems unfortunate to me that we would be penalized for trying to take care of our health. But yes, we can certainly share those recommendations.
Yes. And then every person that we've talked to this year has said, get a flu shot, get a flu shot, get a flu shot. So I'm glad to see that people are heeding that advice and hearing that the immunizations are higher. I think some of the other things that are mentioned often, or were quite some questions that came up, were around pneumonia and shingles. And were those things that also were critical to keep up with.
Absolutely. So again, talk to your doctor about when that's right for you.
We have another couple of questions, and these are in the area of COVID-19. Now, we recognize it's not your area of expertise, so if you wouldn't mind sharing information that you're comfortable sharing, we would sure appreciate that. This question submitted by Raquel: do we know anything about how our COVID-19 affects women who are pregnant or want to become pregnant?
Well, we do know that pregnant women, especially in late pregnancy, who've had COVID, seem to have had more severe impact from the disease. So I think, obviously we're all being careful, but being extra careful. Clearly it's been a tough time in terms of visiting. And, we certainly had a brief period where things were so challenging in New York, where we weren't even comfortable letting partners into the delivery room. And that was just a horrible time for everybody. Yeah, so there is evidence that it does seem to have a more severe impact, especially on late pregnancy. So again, important to be as careful as possible.
In this last question, should women be concerned about whether the COVID-19 vaccines can potentially impact fertility?
No, that's all I'm saying. No.
Okay.
But what I will say is, since I know we're streaming live on Facebook, there is lots of reliable advice out there. The CDC, your own doctor. I'm delighted when my patients do their homework and do their research and come in with questions. But I think it's so important to understand that there are social media. There's social media content out there that is simply not science-based and not even fact-based. So I really think at this time, given the challenging times we're in, rely on those entities which really have proven themselves to be committed to the truth and to science.
Great. That actually wraps up our session of questions. Julie, do you want to cover the resources?
Sure. Dr. McGinty was gracious enough to connect us with the American College of Radiation and some specific resources that they shared around some of the things that we've discussed today. So everything that we've talked about, I believe that we're being popped into the chat. Those we will also be sending a follow-up email to everyone that's registered today. That includes links to all of these pieces of information. So you'll have that as a follow-up. I just wanted to say there's one more question that came up in the chat. I just wanted to ask that. Is the colon screening still recommended every 10 years, or has that changed for the colonoscopy? Are you aware, Dr. McGinty?
Well, we are starting to recommend starting screening at 45, not 50. And the screening intervals, again, check with your doctor.
Okay. And another question that we had here was that if you've had COVID-19, do you still need to get a vaccine? And again, I don't know if this is an area that you're...
I'm probably not going to be comfortable commenting when we know that's going to be a question. A lot of people who have had COVID-19 or feel like they had it may not have actually had testing. And so I think it's something to check in with your own doctor. And certainly if you're a healthcare worker at the front lines, your hospital or health system will be giving you guidance on that.
I'm so excited. My sister's a nurse practitioner and she's getting her vaccine on Friday. And
Oh, that's great.
I'm so relieved. She's so relieved. Our healthcare workers, you included, have been absolutely heroic during this time. It's been really amazing to see how, people that have dedicated their life to serving others have been so selfless during this time. So
well, I would say that the biggest thank you, and I'm by no means on the front line. I give such credit to my colleagues in the emergency department and the ICU, and the biggest thank you we can get is to see everybody wearing their masks, socially distancing, and washing their hands.
Thank you. We're going to share a couple more resources here, things that were recommended by Dr. McGinty. I know, Doctor, that you need to leave us. So we will again say thank you for this, for sharing your expertise with us today on a really important subject for so many of our members. And again, just your excellent advice on how we continue to take care of ourselves as women during this time.
Thank you for having me, and I wish everyone a safe and healthy holiday season.
Great.
Take
Thank
care.
you so much.
Bye-bye.
And if you want to hang with us for just another moment, we're going to share a few more things with you. We have some resources from the Society of Breast Imaging, or the partner of the American College of Radiology, that get into very specific information around when it makes sense to get a certain type of breast screening test, an MRI versus a mammogram versus different types of mammograms, and also really that importance of beginning the screening at age 40. Take us to the next page. Also some really great resources that Dr. McGinty shared with us. Kaiser Family Foundation, looking at how coronavirus affects different genders. Really interesting article from the Lancet on the effect that COVID-19 has had on women and girls the world over. An important piece from Psychology Today on why it's so important for women to practice self-care and to maintain our own health during this time, and then some other information on the difference that Dr. McGinty did such a great job explaining earlier, the difference between a diagnostic mammogram and a screening mammogram. And then from a MedicAlert standpoint, I wanted to make sure that you were aware of some other resources that we have a COVID-19 resource center that includes a lot of links. We've taken a lot of care to provide vetted resources from trusted experts in the field. So there's information there about if you're living with a very specific medical condition, what does COVID-19 mean for you, as well as some more general resources on how to best manage through this extended period of chaos and craziness that we're living through right now. And then if you enjoyed this today, I encourage you to check out some of our previous sessions. We have talked about everything from chronic disease, stress and anxiety, diabetes, heart disease, autism, allergies, asthma, Alzheimer's. So whatever you're interested in, there is probably something within our library that talks to that. We've had some really fantastic experts visit us over the last several months, and encourage you to take advantage of those. One thing we'll also ask is, as we mentioned at the very beginning, MedicAlert is a 501c3 registered nonprofit. We do provide a 24-hour response service, training for first responders, and also MedicAlert IDs and memberships for people who are facing financial hardship. If you are so inclined, we would very much welcome a donation during this time. You can go to medicalert.org/givehope and contribute there if you'd like. We would very much appreciate it. It helps us provide the resources to do events just like this.
For a few more moments.
And at the same time, I'll tell you a little bit about our next session on July 13th of July. Wow, wishful thinking. January 13th, as we move into 2021 and leave 2020 behind us. The very first thing that we'll be talking about in our next session is the status of the current COVID-19 vaccines. And as you know, that's a subject and a situation that's evolving very quickly. But we have several experts that are going to be joining us to tell us what the statuses of those vaccines are, what the plan is for rollout, and be able to answer questions that you might have about those vaccines and next steps there. So we encourage you to join us in January. We will have the registration open within the next couple of days, and we'll be sending you a reminder about that as well. So, so please do come back for that. And with that, I would like to thank you for joining us today. Again, our thanks to Dr. McGinty for sharing her expertise. We are fortunate that so many really talented and smart people have been able to join us for these sessions to share their information with you. And we're happy to do that. So thank you again. Thank you, Melody. And we wish everyone a very happy holiday season.
Take care and stay safe. Bye-bye.